About to start the relaxation flow. So everyone come and lie on your backs. Right. Can you hear me okay?
Yes.
Okay, because I've got some music on today. I don't know if you can hear that or not, but so if it starts to take over, just let me know. I'm going to turn it down a little bit actually, it's a bit too loud. Okay. Right, so if everyone lies down with a pillow or a towel underneath your head, feet hip distance apart, and we're just going to think about the connection first. So we should be feeling connected underneath our feet, underneath the lumbosacral junction, TL junction, both shoulder blades and the back of the head. So we're just going to try and get better connected by doing a few postural cues, a few postural changes. So first of all, we're going to think about our feet. Which foot are you feeling more connected? If you're feeling it more on one side than the other, you're just going to shift your weight from side to side until you feel like the weight is equal both sides. And then you're going to think about whereabouts you're feeling that pressure underneath your foot. So are you feeling it more on the outside or more on the inside? So if you're feeling it on the outside, you're going to pull the inside of the foot down towards the floor without lifting the outside. If you're feeling it more on the inside, you're going to try and pull the outside of the foot down towards the floor, but without lifting the inside of the foot. Okay, now we've done that, we're just going to work our way to the lumbosacral junction, so junction between your lower back and your pelvis. So to get better connected here, we're going to start to do some pelvic tilt. So we're going to lift the spine away from the floor, tilting the pelvis in an anterior position. So it's tilting forwards. And then we're going to reverse peel the spine down into the floor, tilting the pelvis backwards into a posterior tilt. So your back should be feeling like it's curving into the spine, into the floor. And then we're going to tilt the opposite way. And we're just going to alternate between those two positions, so anterior and posterior, feeling that movement in the spine. And then once we've done a few of those, you just want to stop in the midpoint between the two end ranges, where your back should be nice and flat on the floor. There shouldn't be any gap between your back and the floor, and there shouldn't be any, your spine shouldn't be indenting into the floor either, so it should just be flat. So you'll have a neutral spine, neutral pelvis. And with that, you'll feel like that lumbosacral junction is nice and connected with the floor. So we're going to work our way to the TL junction. So think of your pelvis and your rib cage like the pages of a book. We want to pull the pages together so that they're parallel and they're not in this open book, flared rib, lumbar extension position. We're going to pull the pages closed, and you should now feel more connected underneath your TL junction and the floor. And the shoulder blades, which side are you feeling more connected with the floor? If you're feeling more on one side than the other, just shift the weight from side to side. Try and feel that more balanced between the two sides. Shoulders themselves want to be neutral, so we're going to try and get out of this internally rotated, protracted, elevated position. We're going to try and activate through the shoulder girdle under here, the external rotators and depressors. We're going to pull the shoulder into external rotation and depression, activated underneath here around the back of the shoulder. So the shoulder blades, imagine they're going down towards the back pockets of your trousers. And then we'll work our way up to the head. So the head wants to push straight back down towards the floor. No neck extension, no neck flexion. You'll feel those muscles at the front of the neck come alive. So we should be feeling now better connected underneath both feet, lumbosacral junction, TL junction, both shoulder blades and the back of the head. Okay, so we're going to work on our breath now. So we're going to put one hand on the chest, one hand on the tummy. And we're just going to think about our breath. Think about what's happening as we breathe in and as we breathe out. So as we breathe in, we want to feel the hand on the tummy lift. And as we breathe out, the hand on the tummy is going to lower. We're going to try and just focus on our breath. Try not to think about anything else. Any stresses or worries that have happened this week, just try and let everything go. Focus on that breath. If you feel your mind is wandering, just pull it straight back to your breath. Clear your mind. Use this as a bit of a meditation. Breath in, hand on the tummy lifts. Breath out, hand on the tummy lowers. No movement in the hand and the chest. Breathe in through your nose, out through your mouth, through pursed lips. Imagine that you're blowing through a straw. Okay, so now you've got your breath in the right order, we're going to grab hold of the waist. Thumbs around the back, fingers around the front, web of the hand around the sides. We're just going to try and create our 360-degree breath. So as we're breathing in, we want to feel all the muscles around the abdominal wall expand. Try and lift and push your hands away. Really try and visualise those muscles. If you're struggling to feel them, if you cough, feel the muscles expand. And now think about those muscles. If you need to do it in stages, if you just focus on the front muscles first of all. Once you've got those, think about the side muscles, pushing your thumbs outwards. And work your way around to the back. Feel the thumb muscles being pushed down towards the floor. And then try and connect everything together so you're feeling it expand the whole way around equally. So equal from front to back, equal from side to side. Again, focus solely on your breath, what's happening in your abdomen. Try and just steer your brain from thinking about other things. Okay, so now we've got the 360-degree breath. We're going to work on the brace. So it's an outward push, not a clench or a tense. You're not sucking your belly button in. So we're going to breathe and expand. And then before we take the breath out, we're just going to do an outward push, like we're pretending that we're farting. So that feeling like you're about to fart. Outward push. Try not to let the muscles relax as you're breathing out without tensing the belly. You don't want to tense the tummy muscles. Let's do a couple more breaths. Okay, so throughout the flow we're going to be thinking about our breath. Try and just bring our thoughts to the breath and the movement. Try not to think about anything else that's been worrying you. So we're going to bring our feet together in our knees, palms facing up, shoulders at 45 degrees, and we're just going to let the knees drop to the side and the head's going to look the opposite way. Feel that rotation in the spine. And then we're going to use the muscles in the abdominal wall on the opposite side to the way that your knees are going to try and pull your rib cage down to the floor, pulling the knees back as you bring the rib cage to the floor, and then you're going to drop them to the other direction and then look in the opposite direction. And then do the same. You're going to pull the rib cage down towards the floor, bringing the knees back as you do it. Drop the other way and look the other way. Alternating sides in your own time. Nice and slowly. Think about what you're feeling right now. So feeling that rotation in the spine from neck down to the pelvis. Keep breathing as well, don't forget to breathe. Do one more each side. Okay, so then get your feet a little bit wider apart. And what we're going to do is we're going to curve the spine into the floor. We're posteriorly tilting the pelvis. Okay, so we're going to take the pelvis into posterior rotation, dropping the spine into the floor, and then we're going to lift the spine vertebrae by vertebrae up off the floor, using the bum muscles to lift, and then we're just going to try and stretch and reach to the opposite side. And then we're going to lower vertebrae by vertebrae down towards the floor. Into a neutral spine again, so don't go into anterior tilt. And then we're going to posterior tilt, indent the spine into the floor, lifting the spine vertebrae by vertebrae, and then reach to the opposite side. And then back, reverse peel, vertebrae by vertebrae, back down into a neutral spine. And we're going to do that alternating sides now in your own time, nice and steady. So posterior tilt, lift the spine vertebrae by vertebrae, use those bum muscles to lift your hips off the floor and then reach. Try not to let the pelvis go into an anterior tilt as you're in the air. You want to be in a slightly more posterior tilt in this position. And then down and back up and reach. Other side. Think about your breath again. Don't forget to breathe. Just do one more each side. Feeling that movement in the spine. Feeling that stretch across the shoulder as well. Okay, so now we're going to get our neutral position. We're going to float one leg into the air and down, other leg, down. So alternating toe taps at the moment from the supine position. Pull your mind back to your breath. And now we're going to take both legs into the air, into the 3-month supine, and we're going to do some double toe taps. So create your 360 breath and your brace, and we're going to lift and lower. Lift, lower, lift, lower. Nice and controlled movement through the hips, no movement through the pelvis and lumbar spine. And then we're just going to finish in the 3-month supine position. So feet higher than the knees, knees over the hips, hips in external rotation. Feet want to be neutral as well, so try not to let them sort of flop inwards or outwards. You want to be slightly pointed towards your head. I'm just going to hold this position, focusing on your breath, focusing on that 360 degrees. Put your hands around your waist, feel that expansion the whole way around. Breathe in through your nose, out through your mouth. You need to put your legs up on the sofa, that's fine, or on the bed, or on a ball. We just want to make sure that the pelvis doesn't go anterior, we don't get that lumbar extension. Now bring your arms up into the air, fingertips pointed to the ceiling. We're going to lift the head slightly, look to the direction that you want to turn, and then you're just going to start to roll, bring the pelvis and shoulders at the same time, so try not to disconnect. And back, and roll the opposite side, nice and controlled. Don't flop down or throw yourself back up, so it's really, really controlled. Trying to strengthen that rotational stability. Something that we don't do a lot of in life. A lot of things that we do are very much in a sagittal plane, so like standing from sitting, that kind of movement. We don't do much rotation, so this is going to help strengthen our core. Try and make sure you have your nice straight spine when you're landing on the side, so that you're not bananaed. And then we're just going to come onto our side, up into a lower oblique sit, up into a high oblique sit. And then from this position, keep the hand on the floor. So we're in our mermaid legs. And then we're going to bring the leg round into a tripod position. Okay, and then we're just going to hinge backwards and forwards. Hinging from the hip. Really focus on what your body's doing right now. So think about what your spine's doing as you're going backwards. Try not to let the spine just round as you go in. So we're trying to keep nice and long and flat through the spine. This movement's coming from the hip and the knee. Obviously only go as far as you can with that, what your back knee's going up will allow. So if you've got a bit of knee pain, don't go as far, just work the range of movement that you can do comfortably. Try not to be too narrow with the foot, because that's going to mean you've not got enough space in the hip, so bring the foot to the side so you've got a bit more space. Focusing on the breath, pulling your thoughts back to what your breath's doing. And then you're going to curl your back foot under, and from this tripod position, you're going to lift and turn into the opposite tripod. And then we're going to hinge again on this side. Nice and steady at your own pace. Remember, this is all about relaxation today. And then from this position, you're going to keep. So if your left foot's on the floor, you've got your right hand's going to stay on the floor, or if your right foot's on the floor, your left hand's going to stay on the floor, and you're going to bring that leg back down into your high oblique sit. Practice that one. So from this position, we're going to do some nice gentle hip rotations. So knees up to the ceiling and to the opposite direction. And round. Make sure that you end up nice and tall in the tall sit, so we're not flexing through the spine. So lengthening through the spine. Rotate one direction and then the opposite direction. Really think about what you're feeling, so feeling that movement through the hips. So as one internally rotates, the opposite externally rotates. You might find that there's an imbalance, so one side might be easier to do than the other. Just practice makes perfect. We want to try and help create better balance. Better movement in both hips. And then go back into your high oblique sit on one side, and we're going to pull the leg from behind in front of the other leg. We're going to make sure the spine's nice and long and straight and not bananaed, the shoulders nice and active. We're going to lift the hip off the floor and turn into bear, and then go around the opposite way. So nice and slowly, nice and controlled, Focus on the movement. Focus on your breath. Make sure that your shoulders and your hips are moving at the same time, so you've got your Lego body. Just do one more and then you're going to end up in the bear position. From bear, we're going to just hinge the hips back slightly and then pull one leg through into pigeon stretch. And then what we're going to do is we're just going to bring the arm down. Well, we're going to do both sides, so we're going to take one arm across. Just feel that stretch down that shoulder. Focus on your breath, feel that where the stretch is happening, so in the bum, in the shoulder. And then take the other arm across. So you're actually going to try and sort of reach across to the opposite side as well, so you're feeling the stretch down the side of the body. Bring the hands back down to the floor, curl the back foot under. Bring that leg back into bear, bear hinge, backwards, and then bring the other leg forwards. And then we're going to do the same, so we're going to reach across with one side, with one arm. Feel that stretch in the bum, feel it in the shoulder, feel it down the side of the back. And then take the opposite arm across. Bring your thoughts to your breath and where you can feel that stretch. Bring the hands back. Then we're going to curl the back foot under, go back into bear, and then into a plank position. So we're going to go from the bear with the knees bent, hips bent, and then we're extending the hips and the knees. And from that position, you're going to take one leg forwards. So this is a new one, I've not done this one before, so we're sort of in the tripod position again. And we're just going to twist round and feeling that stretch in that bum. So hands staying on the floor. Okay, no problem, Colette. Have a nice day.
Thank you.
See you soon. Bye. Great, I'm glad you enjoyed it. Bye-bye.
Bye.
So just focus on where you're feeling this now. So you should feel it in that bottom, and you'll probably feel it down the side here. Focus on your breath. Now bring the hands round, come back into that position, and then you want to drop the knee, and we're just going to rock backwards into a stretch of that hamstring. And then back up, curl the back foot under, take that leg back into your plank. Now take the other leg forwards. And then we're going to drop round. And then feel that stretch. So now it's in the other bum. And I don't feel it as much down this side, so I'm obviously not as tight in this direction. So again, you might feel different from side to side. One might be more difficult to do than the other. Focus on your breath. Try not to let your minds wander. If you feel them thinking about other things, just pull it back to the position you're in, thinking about what you're feeling and your breath. Now bring that back round, drop the knee, and then we're just going to stretch backwards. Again, feeling that length through that hamstring. Come forwards, curl the back foot under, bring that leg back into your bear position, and then lower the knees down into your quadruped. So we're going to get the pelvis into a neutral spine, so rock the pelvis backwards and forwards, find your neutral, make sure your upper back is nice and lengthened, so trying to pull the upper back down towards the floor without going into lumbar extension. Nice long neck. And we're just going to hinge backwards. And as you come forwards, go into your... I never know whether this one's cat or camel, but I think it's cat. One where your back arches up to the ceiling. And then we're going to rock backwards into the hinge. And then come forwards. And then we're going to go into that back flexed position. Nice stretch through the spine. Back into a neutral. Hinge backwards. Forwards. When you get to the midpoint again, you're going to arch the back up, back down, hinge backwards, and up. Back into your neutral position, upper back pull towards the floor, and we're just going to drop one elbow to the floor, and up, drop the other elbow to the floor, and up. So alternating sides, feel that rotation in the spine. Alternating from side to side. One more each side. So from quadruped, we're going to curl the back feet under, make sure you've got your neutral, make sure your upper back's nice and long. We're going to lift the bum and the knees off, well, bum into the air, knees off the floor, and we're just going to hinge backwards, hinging through the hip. If you lift your bum into the air a little bit more, it means that you'll probably get less lumbar flexion, you'll be able to get a bit more hip flexion, and then down into bear, and then back, hip flexion, pushing the bum backwards, and then back down into a low bear, and then into a high bear with hip flexion. One more of those. Give your legs a little bit of a shake off. Back into bear, and then we're going to just straighten the legs and go into a downward dog. And we're just going to hold that position, focusing on the breath, thinking about where we can feel that in our bodies. So I can feel that down the backs of both my legs. Back down into bear. Then we're going to walk the hands back into our squat. Just hold that squat position. Breathe in, focusing on the breath. Focus on that 360 degrees. And then stand. And we're just going to lower down, stand. Try and make sure as you go in, you've got that neutral pelvis. So if you need to reset every time at the top, so neutral, put your hands on your tummy and your back, and then just feel what your pelvis is doing. Make sure it doesn't go into that flexion or posterior tilt as you're going down, or anterior tilt as you're coming up. So up and down, in your own time, don't rush it. Last one, walk your hands back out into bear, take one leg forwards again, into your tripod, up into your high kneel, and then we're just going to hinge backwards. Again, only as far as that back knee allows. Make sure you're hinging from the hip. And then from this position, from the high kneel, if you need to get your cabinet next to you again, we're going to go into our stand. So pelvis level with the floor, make sure you're not too narrow with the foot, so foot out to the side, neutral spine, and then we're just going to curl the back foot under and stand. Take that foot back and then slowly, slowly lower back down. Come up. Slowly, slowly, slowly lower back down. Trying to keep pelvis level with the floor as we go. Don't let the knee cave in, pelvis shoot to the side. So if you do need that support next to you, a chair or a bedside table or anything, that's fine. As you do this, you'll gradually get stronger. This movement will become easier. And then as we go back this time, we're going to go from this high kneel. Imagine you've got your ball in your hands. Pick the ball up, lift it over to the opposite direction. So you're in the opposite high kneel, and we're going to hinge. So hinging back, Again, think about your breath, 360 degrees. Think about where you're feeling this in the body, so down the back of that leg. Think about what your hips doing, what your lower back's doing. Do one more. Okay, and then we're going to go from this high kneel. Make sure the pelvis is level. Foot out to the side, curl the back foot under and stand. Oh, went out to the side a little bit then. Slowly lower down and up. Slowly lower down. So just do some of these in your own time, don't rush them. Just do a couple more and then we're done.